Costs of hospital visits racking up for nearly 100 million Americans, estimated to be carrying recurring medical debt. The prices consumers pay varying extensively nationwide among healthcare providers.
Why pay more than $3,000 for an MRI if you can get it for $300?
It's that type of disparity that led Cynthia Fisher to start PatientRightsAdvocate.org, a nonprofit organization dedicated to fighting for system-wide hospital price transparency.
We now have the right across our country for 2.5 years to know all prices in healthcare from both hospitals and separately from insurance plans.
Fisher is referring to the Hospital Price Transparency Rule implemented by the Trump administration in January of 2021 that requires hospitals in the U.S. to make their standard charges, including discounted cash prices, available to the public with easy access online, and fines them if they don't. Ever since then, PRA has looked at pricing information twice a year for roughly 2,000 of the more than 6,000 hospitals in the U.S. The report lists hospitals as either compliant or non-compliant and explains what a hospital does and doesn't display that's required by the federal government.
When hospitals aren't showing all of their prices, they're harming patients every day because patients delay getting care for fear of financial ruin.
In PRA's latest report issued in July, 3 area hospitals were listed as compliant: Lutheran Kosciuszko in Warsaw and Northwest Health in both LaPorte and Knox. The same PRA data claimed 5 hospitals were listed as non-compliant for various reasons: Beacon Health System's Elkhart General and Memorial in South Bend, St. Joseph Health System's Mishawaka and Plymouth Medical Centers, and Ascension's Borgus Lee Hospital in Dowagiac. Ascension telling 22 Investigates in a statement it's proud to be a leader in price transparency and goes beyond the rule, offering consumers tools to estimate costs and provide feedback. St. Joseph Health System saying in part it's compliant with regulations and fully supports healthcare pricing transparency and tools that are understandable and easily accessed. Beacon says price transparency is a priority and referred 22 Investigates to the Indiana Hospital Association, which points to a different report authored by Turquoise Health, a company that tracks hospital price transparency. Elkhart General and Memorial Hospital both received a 4 out of 5 score for compliance, and Indiana overall was ranked as the 4th most compliant state for price transparency in the country. IHA President Brian Tabor says Indiana hospitals are working hard on transparency, calling the Patient Rights Advocate organization agenda-driven, with a mission to advance legislation and an unwillingness to correct its record of incorrect transparency reports.
There's an expected outcome, and that outcome is they want to see low scores. And so that's the way they approach it.
The nationwide estimate of how many hospitals are complying also varies. Fisher says based on PRA data, full hospital compliance overall is only 36%, a sharp contrast to the American Hospital Association's estimate of around 80%. AHA claims some third-party reports continue to mischaracterize compliance despite hospitals' efforts to increase transparency.
Probably the biggest disconnect between what they're looking at and what they claim hospitals should be doing and what the rules actually say have to do with blank cells.
Molly Smith, AHA's Group Vice President for Public Policy, says there are a lot of reasons why there might not be a price listed on a hospital's website. For example, the hospital and insurer didn't negotiate on a particular service, the hospital may not even offer that service, or pricing with the insurer was bundled and they're not negotiating for every single item.
So in those instances, hospitals will either have a blank cell or it'll say NA, like not applicable. And unfortunately, some of these vendors are looking at that and saying, well, there should be pricing data here. Therefore, we're going to say that these hospitals are non-compliant.
PRA is now calling on the federal government to better enforce the law, issue fines timely, and to make Americans more aware of the price transparency rule through public service announcements.
When we can see all of these prices, we can fight to get a fair market price. Don't accept being charged 10 times more.
I'm John Paul. Thanks for watching. Here's another video for you to watch. Also, please take a moment to subscribe to our channel.